And I was riding a motorcycle around a sharp turn, maybe 3 or 4 years ago, and something was sticking out of a pontoon boat on a turn and broke the mirror off my motorcycle and hit me in the mouth right here. Only my mouth. I know. No nose, no chin, no nothing. Just teeth. I didn't even see it. It was so tight. Like literally almost a 90-degree hairpin turn. I'm on the inside of the outside lane and the guy's on the outside of the inside lane, and took a chrome mirror and put it right in my teeth. It was so quick, almost literally no pain, no nothing, but it was obvious something happened. I looked down and there's blood in my lap, and I filled my mouth and I could stick my finger into my lip with 2 or 3 teeth missing and 1 dangling. Wrote it out, pulled over to the side, and when I got up, one of my 2 front teeth was in my lap. Emergency room. That was an exercise in frustration there. They don't know dentistry. They know cosmetic surgery on my lip, and they literally took a piece of small rope and tied this tooth onto this tooth in the office. That was their fix. There was zero dental expertise or experience in my treatment at the emergency room immediately after the accident.
So when Will came into our office, he had just been to the ER because he had some debris hit him in the face while he was riding his motorcycle. And so I honestly want to say he almost had a tooth in his hand, but he had a couple of his teeth lassoed together from the ER and arrived, and it was basically like, help.
I don't make a living, but I make a significant amount of money off of, how I look. So it was very important to me to make sure that I went back to as close to as possible, or better in this case, than what I was.
We took a CT scan of him, kind of evaluated the whole situation, and realized that he may lose more teeth than what he already had lost. And so we were going to do our best to preserve what he had and save the teeth that were mobile. He had fractured his whole pre-maxilla, and so we needed to basically bone graft and kind of wire that area back together, and then ultimately put in dental implants and restore his smile that he had. But yeah, when he first arrived, he was not in a good way. Choosing
the appropriate doctor for the cosmetic part of this was the most important part of the whole recovery. Dr. Blue gave me, on the initial analysis, he gave me the real world situation. There was no sugarcoating, which I preferred. He gave me, multiple options for everything that I could think of that would be, I don't know what I don't know. So he gave me what I feel was a complete in-depth analysis of where I am and where I can be and how you get there. There's 2 implants, the front 2 teeth are implants, and there's bone grafts, and you install the implants, let the gums grow around it, and go from there. I would say easily my smile's better than it was. So I had 45 years of grinding, so the canines were flat. My whole front smile was flat. Based on my smile before the accident and after the accident, I would say if my before smile was a 10, I'm a 20.